There's a TikTok user that posted this picture of this fifth metatarsal base fracture, and it sounds like she had been to both a podiatrist and also to an orthopedic surgeon and got two different diagnoses and two different recommendations from a treatment standpoint. So apparently the podiatrist diagnosed this as an avulsion fracture of the fifth metatarsal base and recommended conservative non-surgical care. The orthopedist, on the other hand, called this a Jones fracture and recommended an open reduction and internal fixation. So I agree with the podiatrist, and it's not just because I'm also a podiatrist, but it's because the podiatrist is correct. An avulsion fracture occurs closer to the tuberosity of the fifth metatarsal base. This is also known as a zone 1 injury. So you can have a zone 1 injury. A true Jones fracture occurs around here, so this would be a zone 2 injury, and then a zone 3 injury would be, well, I can't point to it, but be even higher up. So understanding this classification is important because it has real impact on what treatment course should be recommended for the patient. A zone 1 injury typically does not need any surgical intervention, especially if it is non-displaced like this fracture. A Jones fracture is much different. Again, that's one that's just a little bit higher up. And the reason for that is this area, from an anatomic standpoint, just does not have the best blood flow. So this fracture is renowned for either delayed unions or non-unions. So delayed union means it takes longer to heal than anticipated, and a non-union means the bone never heals. So what was interesting was the diversity in comments within the comment section of this post, because no one could agree whether this was a zone 1 injury or a zone 2 injury. But I gotta tell you, this is a pretty classic zone 1 injury from a textbook standpoint. There was even an orthopedist that made a comment that he hates to say it, but the podiatrist is correct, and surgery is not recommended for this type of fracture, at least in the acute setting.